My name is Sheldon McLeod, and this is Thinking Out Loud, presented to you exclusively here on the Saltwire Network. And another Friday, another winter storm for the weekend. And said before, I'm done with winter, but apparently winter's not done with us yet. And earlier this week, we experienced something, a very different tone, I felt, with the Premier and Dr. Strang at the COVID update. Very much signaling it might be the last one, might be the last COVID update after years, 2 years. The public, all the COVID restrictions coming off March 21st, proof of vaccination leaving February 28th, just in a couple of days. And the Premier was very clear about saying, you know, this will be coming as a relief to some, and it will be a sense or a source of anxiety for others. And that's true, very much so. I saw a tweet after that, from Dr. Lisa Barrett. I feel like today is a good day to get back to tweets highlighting science and uncertainties at this point of the pandemic, and perhaps distinguish those facts and lack thereof from popular opinion and wants. Sound fair? Absolutely, because I need to hear what she thought of the Premier's comments on Wednesday.
At this point, I would be talking about case counts and hospitalizations in my remarks. But today is different, and that's because, you know, we know that COVID zero it's not a reality. Certainly not right now. Someday, hopefully, maybe it will be, but it's not right now. Living with COVID, that's the reality. That has to become our new reality.
Our new reality is living with COVID, according to Premier Tim Houston. Dr. Lisa Barrett has been very much accessible to the media, very much a voice throughout the last 2 years. And thank you again for joining me in conversation.
Oh, it's nice to be here.
What went through your mind when you heard the Premier of Nova Scotia say, COVID zero is right now not possible. We need to start living with COVID?
Well, I don't think COVID zero is something we're aiming for at the moment. And I think we're already living with COVID. And in fact, in Nova Scotia, I think many of us have been living. Sorry.
No worries.
I apologize. Where do you want to go from?
Keep going.
Okay. I think we have been living with COVID, and we're going to continue to live with COVID. The question is how we live with COVID, and whether the only options are do everything, meaning lockdown in terms of restrictions, or do nothing and pretend that it doesn't really exist. And I think somewhere in the middle there is where the science might lead us to go.
I had put on my Twitter account, what would you ask Dr. Lisa Barrett? And I heard from a number of people, Todd Leader, I don't know if you know Todd, but he's a very brilliant mind, a very kind man. And he asked, I would ask her to use science and her instincts, got to comment on the phrase people have been using across this country. You touched on it. It's time to remove restrictions because we need to learn to live with COVID. How does she interpret that phrase? And what does she think of that concept?
Yeah, so I think this is actually a great question. And there's a logical fallacy built in there. Just because we have to figure out, and we are figuring out, how to live as much as we can with COVID in mind, that does not mean getting rid of any and all precautions. I'm not going to call them restrictions, precautions that acknowledge what we do and don't know about the virus. So just because we stick those two parts of a sentence together, we've got to get rid of restrictions because we need to learn to live with COVID. That actually isn't the only option. And I think people really need to take a step back from linking two unlinked statements. Yep, we do have to learn to continue to live with COVID, and as much as we can, but that may not, for the next number of months, mean completely getting rid of minimally invasive and helpful precautions like masks and testing, while there's a very large degree of scientific uncertainty about where this virus is headed next.
With that in mind, another question that's touching on that, Natasha, she acknowledged yesterday that easing of restrictions is placing unfair burdens of isolation and risk on vulnerable population groups. This person, Natasha, says, I'm immune compromised. How do we move forward safely in the absence of reliable information and what feels like a dangerous rush to normalcy?
Well, I think a couple of things. Number one, let's all acknowledge that there are lots of things we know now and that we can use. We know that vaccines are still very useful, and particularly in the first few months after the booster, to protect against infection as well as death and hospitalization, even with Omicron, and likely with the newest version of Omicron-ish like virus that's starting to circulate in Canada now. So vaccines work, masks work, and we know that testing is a useful tool for us to use as well. So keep that in mind when you're feeling fear. You still have access to those tools in Nova Scotia around masking and testing at the moment for vulnerable people and the folks around them. And I think the big thing we need to do right now is, number one, educate people who are at risk for bad disease, regardless of their age, because of their medical issues. And that includes people who are immunocompromised, who have cancers, but also people with multiple other medical problems put together. Those people are at risk. And there's a lot of people around those folks, and we need them to understand they're at risk. Please test early and know that if you do get symptoms, you need to seek out some help so that they can stay protected. So that's what I tell people who are in that boat, who are very vulnerable, but also masks work best when everyone is still using them in public places. And I don't see a good reason for people not to be doing that. And I have no idea why we wouldn't be suggesting to people, not only is that recommended, but necessary in public settings.
So what is the risk if, as the Premier said, you can wear it if you want, but you don't have to if you don't? What's the risk there?
Well, I think we've all seen that things that people don't have to do at this point, but are recommended, fall to the wayside. I've had multiple people say to me over the last few days, wow, you must be so glad that this is all done. And I said, not quite sure where you're living, but on the planet Earth, this is not done yet. And in fact, most people in the science community are quite concerned about what virus is coming next and the fact we don't have the ability yet, enough knowledge to predict where this is headed in the next 3 to 6 months with new viruses. And so what I tell people is I really, really think this is not done. And I really hope that people consider when Dr. Strang says it is highly recommended that you wear your mask, that what he's saying is you need to wear your mask. There is no bad impact of wearing a mask. We've been doing it for 2 years, and many cultures have been doing it for multiple years. If we could do that for another while longer, it would seem to be a very low inconvenience, unharmful thing to do that protects a heck of a lot of people. Because guess what? Vulnerable people don't walk around with a sign on them saying, I'm vulnerable.
And I think Dr. Strang did acknowledge that he's hoping to see this as a culture moving forward in closed spaces during the winter months when virus is circulating. And also that qualifier was made that, if things continue as they are, then things will be released or relaxed. And that was another question someone had. I wonder, Clark Swim says, under what conditions do you see restrictions being reinstated? Have we reestablished circuit breaker type policies for what will now be this new normal endemic phase of living with COVID?
Yeah, again, the word endemic does not mean mild, and it does not mean that there aren't times when this virus is still going to surge. If this virus shifts completely away from vaccines and all of the things that we have and becomes super transmittable, which we don't know that that's not going to happen in the next few months. Again, we don't have enough information yet to predict that. If that does happen, then there will be a surge of cases like we saw in the beginning, potentially. And therefore, I think it's really important for people to set their table and their expectations that if we take away all precautions and the easy stuff like early surveillance, testing, and masking, over the next number of months, that we could end up in a situation with a big surge virus. And if that happens, it's going to be a late thing for us to recognize if we don't have some precautions in place. I don't know what the guidelines are that policymakers are setting to consider going backwards. Many of them are using this term, we just won't do it. I don't know what that means when they say that, because we don't know that we're not going to go backwards. But I can tell you the way to reduce the chances of that happening, that we would need something like that happening. And that's to have early surveillance with lots of testing and masking. That will help to limit the impact of any big shift in the virus. And if we ignore that, then I think it's silly to say that we would never have to go backwards significantly, because we can't predict that.
That's obviously been the challenge, is the unknown and following the science. I wanted to as well. There was another question that was asked about: are you concerned that government is making decisions based on taglines instead of science?
I have no idea what I think. I think people are trying to do the best they can at this point, and I think we've got a lot of really smart minds and a lot of really good track record, especially in Nova Scotia, within public health and our government decision making. And I have no idea what happens within that decision making process. But if you hear sentences that get linked to "we are taking masks away because it's time to move on," that's not actually a science statement. That's just a proclamation. But I have no idea what's happening. And it's not just Nova Scotia, let's be clear. This is many other provinces and some other countries. And folks have asked me very significantly and frequently, well, if other people are doing it, why wouldn't we? And I think if we search not too far back in our memory banks, we would see that that hasn't served people well to follow other countries in particular. We've done very well with setting our own beat and moving to it here in Nova Scotia. And that persistent caution, but always moving forward a bit, we've had lots of leeway here many times, has served us well. So if people ask the question that goes along with that, which is, if other people are doing it, why aren't we? The answer might be because we are trying to find a way to follow the uncertainty of the science at this point a little more.
Or as my mother would say, if your friends jumped off the bridge, would you jump just because?
Exactly what my mother would say too.
Exactly. There was another question I had from someone who wanted to know about your painting behind you. That was another question that came up. Are you or Dr. Strang concerned that about what happened in Denmark, where they lifted restrictions and then saw an outbreak afterwards? And once the public health restrictions or guidelines or cautions are removed, it's pretty hard to put that pace back in the tube.
It is hard to go backwards at this point, especially with the amount of fatigue people have. I will say that part. About Denmark, the other thing that we should notice is that cases are expected to go up when you take away precautions. The reason we've gotten cases down, let's be clear, this is not because the virus has taken a little hiatus. It's because we've had high vaccine rates with high boosters that have impact for a few months at least. And then we've also been doing other public health measures like masking and lots of testing with contact tracing. When we take all those away at about the same time, we know that the virus is going to come back and cases are going to go up. In Denmark, though, so far, the hospitalizations have gone up, but ICU rates have stayed lower, which is helpful and good to know. The challenge is the hospitalization rate has gone up, and we don't know where that's going to go yet. But if it continues to rise, our system, unlike Denmark, doesn't have quite the flexibility to absorb that. And right now, we're still at 100 and some odd % occupancy within our hospitals. Where exactly are we going to put those folks when we take away the simple stuff like masking and testing a lot more people? And I'm not sure about the answer to that. So am I concerned? I expected it. And we better be able and ready to deal with it when it happens here.
What is the relationship between you, the public health office? You're an infectious disease expert. Dr. Strang has mentioned your role within this. And maybe that question is on the minds of others. How have you been a part of this? How has this happened that you have been a voice of this, and yet you can have a different perspective or opinion that doesn't directly relate to the decisions that are being made in our public health office?
Yeah, and I do want to be clear that my advice and where I come from are based on I'm a viral immunologist, which means I study immune systems and how viruses respond, particularly, viruses that hang around for a long time. And I'm also an infectious disease doctor and researcher. So that's where my information comes from. And you'll notice I don't often say we should do the following, or here's my comment on the following government part, because to be honest, that's not my job, and I'm not a public health expert, nor am I a government official. I have been providing some advice on some committees within government and within the Nova Scotia Health Authority around therapies, and been doing research throughout this. But I do not make policy, nor do I weigh in on policy around government decisions. And I think that's great. I think it's really wonderful to have people coming at things from different perspectives. And it's always good. I love it as a researcher when I have people providing input to me who aren't directly involved in a project, for example, because that lets me get a different perspective over time. And so I don't know if that answers the question, but I think my role is consultative. And in the public realm, I try and act as a translator of information that's out there around the science of this viral infection, not so much to comment on the policy part, but just I do have some insight from an infectious disease perspective on what might happen if we do or don't do something.
Yeah, I saw you shared a thread from another immunity expert, ideologist, but that's not an idealist or an ideologist. That's a clinical phrase, clinical term. Is this too fast? All of this, the end, this announcement, pulling the plug.
So I'm gonna go back to the presser and say they didn't say this was the end. There was very clear direction that this was not the end, and we did need to be aware that there's a lot of virus out there and look after each other. I think there's a lot of uncertainty out there right now around this virus and where it's headed. And if we as a group don't keep some of the basic inconvenient but not harmful precautions around us, there's a reasonable chance that we will end up having a bigger impact over the next number of months, not just on vulnerable, but a lot of our society, because we are going to be behind the 8 ball a bit. So I don't know if it's too fast, but I know that I have a lot more uncertainty now than I'm going to have in 3 to 6 months. So we will see how things go. Hopefully, if there are signals that we're headed in the wrong direction, then Nova Scotians, as well as our leaders, can help us to modulate what we do next and bring some caution back into that.
As mentioned, Dr. Lisa Barrett has been a translator in many ways over the last couple of years, and I'm certainly grateful for the time that she's afforded us, all of the media in Nova Scotia. Thank you for that. I really appreciate it.
Thank you for having me on.